Hey guys, okay, let's take a look at that second half of our endocrine system chapter. So let me go ahead and share that PowerPoint with you guys so you all can follow along with me. If it would open up. There we go. Okay, so now we are taking a look at section 2. So let me go. Sorry, this takes a minute to get going. Okay, so in section 2, we're going to take a look at the rest of our endocrine glands as well as their hormones and then what they do to the body. And then in a couple of them, we take a look at hyposecretion and hypersecretion. Hypo, if you guys remember from medical terminology, if you guys went over this, hypo means too little and hyper means too much. So we're going to talk about what happens, again, if we're thrown off kilter, how that can typically result in disease or disorder. So let's first take a look at the thyroid. So we started the first section, we looked at the pituitary gland. You remember there were 9 glands that we labeled on that labeling diagram. So we've already looked at one of those. And we looked at that on its own simply because of all of the different hormones that came from that gland. So now we're going to go through the rest of them. So number 1 we had labeled on that diagram was the thyroid gland. The thyroid glands, actually the thyroid gland, not glands, secretes 3 different hormones. You don't have to worry about the difference between follicular cells and parafollicular cells. I just want you to focus on the 3 hormones that come from this. We have what's called T3 and T4. Those are your main thyroid hormones because of what they do to the body, and I'm going to get into this. And then we have calcitonin. Calcitonin, as you can kind of tell by that prefix, calci, we know that it's going to regulate calcium. So let's talk about that. So T3 and T4 are actually abbreviations for triiodothyronine and tetraiodothyronine. But as long as you guys know those as T3 and T4, that saves you the trouble of having to spell those bad boys. So T3 and T4 is all you really need to remember for that. The main thing that the thyroid does for us is it helps to regulate our metabolism. So it gets into some other things that it does, but it kind of all pertains to metabolism. So it says that it permits proper functioning of all other hormones. So it regulates some of our other hormones too, promotes natural maturation of the nervous system, promotes normal growth and development as well. So the biggest thing to remember with this is metabolism. So we had, if you remember from the first video, we had talked about how the pituitary gland, specifically the anterior pituitary gland, secretes a hormone called TSH. TSH also, again, abbreviation for thyroid stimulating hormone. Again, what happens is kind of a chain reaction, that my metabolism slows down for whatever reason. What happens is the pituitary gland recognizes that, stimulates my thyroid that's located again on my top of my trachea, stimulates a thyroid to release T3 and T4. It's T3 and T4 that once put into the blood will help to target all of our different cells in the body to help increase the metabolism. So that's what that does, helps to regulate our metabolism. And then I mentioned calcitonin. Calcitonin helps to regulate our calcium levels in blood. What specifically calcitonin is going to do, and this is something that I believe we talk about in the next couple slides, but calcitonin more specifically helps to lower our blood calcium. The way that it does that is it takes that calcium that we have in our blood and it sends it to our bone tissue, and we know we're very familiar with that our bones are a storage reservoir for that specific mineral. It helps to make our bones stronger, and it helps the process of ossification take place. So this is the hormone that we want to be actively working. What this simply means is calcium is high in our blood because of the fact that we have calcium in our diet. Calcium in our diet means that our blood is going to pick that up in our digestive system, and so therefore we're going to have an abundant amount in our bloodstream, and therefore we're going to need to regulate that. Remember, homeostasis says that we need to be level, we need to be here. So if calcium goes too high, then calcitonin is going to help bring it down a little bit, and that's how it does it. It goes and takes it to our bone tissue for storage. So again, I had just mentioned that T3 and T4, their job is to regulate our metabolism. And it really promotes a lot of other things in our body. Oftentimes when something's going wrong, we oftentimes will ask, our doctors will oftentimes ask, is your thyroid off? Is your thyroid hormone working properly? So sometimes that can kind of be an indicator of something. So this is sometimes what results when we have not enough of our thyroid hormone or if we have too much of it. So hypothyroidism. So again, what this means, the prefix hypo means we're not getting enough. So when we have a deficiency of T3 and T4, then therefore our metabolic rate is going to be slowed, or myxedema is what that's referred to as. So that could cause a number of issues. Can cause a slowed heart rate, can cause just all kinds of issues, can sometimes lead to weight gain and some other issues in the body. So the thyroid hormone, T3 and T4, we want to make sure we're getting enough of it. On the other end, hyperthyroidism is when we have way too much of the thyroid hormone. And a lot of times people think, well, what could be the problem with that? If I have too much of T3 and T4, therefore my metabolism is going to be really high, and that's a really good thing, right? In a sense, but it can lead to a lot of other issues too. That hyperthyroidism can cause an accelerated metabolic rate, can lead to a serious condition called Graves' disease even. And an increased metabolic rate, we again are thinking that could be a good thing, but thinking about what that does. Our metabolism in our body is collectively all of the chemical processes that are taking place in our body. So not just the breakdown of food, but sometimes the buildup of proteins and just all kinds of other things that are happening in my body. And if that happens at an increased rate, it can lead to a high heart rate, therefore maybe even insomnia, having trouble sleeping at night, can cause all kinds of other issues in the body. So that's what that means. And that's what I want you guys to be familiar with on this slide. Just simply know what hypothyroidism is and hyperthyroidism as well. All right, so this just explains to you guys what I talked to you guys about T3 and T4 on the last couple slides here, that what happens in the body is a hypothalamus is what really recognizes our metabolism slowing. So it releases a particular hormone, TRH, which you don't have to be familiar with, but it stimulates the pituitary gland to release TSH, as you can see in the picture here, to release TSH. TSH will then target the thyroid to release T3 and T4. Once T3 and T4 are released, it will then stimulate the tissues to increase the metabolism. And again, once metabolism goes back to normal, then T3 and T4 will be turned off. And again, that is the negative feedback loop. We will stop producing those hormones, or stop secreting those hormones once we get to that level we want to be at. Otherwise, it can lead to hyperthyroidism, and we don't want that to happen. Again, homeostasis off balance can lead to problems. So again, these are the abbreviations for those. Again, as long as you know them as T3 and T4, you're good. But the reason why I bring this up is because iodine is an essential nutrient that's needed for our thyroid gland to function properly. If you remember me mentioning that, you may have heard the iodo in that word. T3 is triiodothyronine, and T4 is tetraiodothyronine, oftentimes called thyroxine. So that iodo is an indicator that it's made up of iodine. Iodine is essential for the synthesis or the creation of T3 and T4. So an iodine deficiency can cause some issues in our body, can lead to a goiter, which oftentimes if you've ever heard or seen somebody with a goiter or seen a picture, it's an enlargement of the thyroid gland, sometimes just a small enlargement, but a goiter is a very, very large protruding enlargement. Iodine deficiency interferes with that negative feedback loop and can cause, again, the off balance of T3 and T4. So iodine is something that is essential for our diet. Okay, and again, calcitonin, as I mentioned to you guys previously, that calcitonin is also secreted by our thyroid gland, and it helps to regulate the blood levels of calcium as well as another mineral called phosphate. What it does is it stimulates the osteoblastic activity in our bones, and again, that's the buildup of bone tissue. Remember, blast being our builders. So it increases that excretion of calcium and phosphate in the urine. So it increases that. Sometimes we have too much of it, so sometimes we need to release it from our body because we have way too much of it. But what we will store in our bone tissue. So that's what calcitonin does. All right, and then on the posterior side, number 2 that we labeled on our diagram was the parathyroid glands. We have 4 small little dots on the backside of the thyroid. They lie along the posterior wall of the thyroid. They are also important for the regulation of blood calcium. So we just talked about that with calcitonin. Calcitonin does that. Parathyroid hormone is actually going to do the opposite of what calcitonin does. So they work kind of opposite of one another. Sometimes my blood calcium levels are way too high, and we need calcitonin to help to bring that down. Sometimes we don't have enough calcium in our blood, and that's where PTH is going to step up. So the hormone that comes from the parathyroid glands is called parathyroid hormone, so named accordingly. And it is going to, like I said, it's going to do the opposite. It actually helps to elevate the blood calcium level. Where is it going to get that? Where do we store calcium in our body? It goes and gets it out of our bones. So this is another reason why we want to make sure calcium is something that's an essential nutrient in our diet, because otherwise, if we don't have that, again, homeostasis in our blood level, what's going to happen if it's too low? PTH is going to go get it out of our bone tissue and bring it back up. And over time, that can be pretty damaging to our bone tissue, and we don't want that to happen. So that's what PTH does. So this shows that process, that if you can see the thyroid gland turned around, you can see those 4 small little nodules there are the parathyroid glands, and it shows how the stimulation of that will help to target our bone, kidneys, and intestines, and it's going to try to raise that blood calcium level by going and getting it from those different places. So it raises blood calcium by different mechanisms. It reabsorbs it from bone, as I just mentioned. It also can reabsorb it from urine. It takes that calcium from urine to tell the kidney, okay, don't excrete this, I need to hang on to this. So there's a process we'll talk about when we talk about the urinary chapter. There's a process called reabsorption, where if we need something in our body, our kidneys can recognize that that needs to be reabsorbed, but also in the intestines. In the intestines, it can absorb that dietary calcium a little bit faster. So by, those different mechanisms. So being familiar with, again, what PTH does. Parathyroid hormone comes from the parathyroid gland, and its job is to raise blood calcium. Whereas when we see an abnormal secretion of the parathyroid gland, so very similar to what we saw with the thyroid, on the hypo end, we see what's called hypocalcemic tetany causing a carpal spasm. So the hypo secretion is actually more serious and a little bit more common than the hyper secretion. What happens is calcium will stabilize our nerve tissue, and then those muscle membranes, so that that imbalance can cause a sustained technic like spasm, can cause that muscle tissue in the carpal. You can see in the carpals here where it causes, it kind of leaves it in kind of a spastic state. So that's what that is. It causes that carpal spasm. All right, on a more serious end, tetany itself causes difficulty breathing, so it has more of an effect on the muscles in your lungs as well, and that can be very, very serious. On the hyper end, too much calcium in blood can therefore then weaken our bones and create kidney stones. Hypercalcemia is what that means. If we're getting too much of that PTH, then that's what that will end up leading to, is too much calcium in our blood, and that's what that means. Hypercalcemia can cause all kinds of issues. And so what it means by bones, stones, moans, and groans is just that sometimes, it can cause issues with the bones, can lead to stones, and moans and groans. It can cause weakening as well. All right. So as long as you're familiar with, again, hypo and hyper and what those represent. All right, so then we labeled number 3. Number 3 on our diagram, the adrenal glands. Very, very similar to our pituitary gland. The pituitary gland, if you remember, had 2 parts. The pituitary gland had an anterior section, the part in the front, where it had some hormones that came from that, and then the posterior section, and it had its own hormones that came from that side. The adrenal glands are both very similar. If you were to cut open the adrenal gland and look at it on the inside, you would see that there's an outside part and an inside part. And we're going to see different hormones that come from each part. So I want you guys to be familiar with the separation of the two as well. That the adrenal medulla, so think middle, medulla is the inner portion. We're going to see what's called catecholamines that come from that. You guys really don't need to be familiar with the fact that they're called catecholamines, but I'm going to show you the two hormones that come from inside there. And that's really what I want you guys to be familiar with. Whereas the adrenal cortex is the part on the outside. So if you remember with the brain, we called that the cerebral cortex, the outer portion of the cerebrum. This is very, very similar. The adrenal cortex is simply just the outside portion. And there's 3 different hormones that are going to come from that part. And we're going to go over that. They are steroids, but as long as you know the hormones, that's the main thing I want you guys to be familiar with. So looking first at the adrenal medulla, this is actually an extension of the sympathetic nervous system. So it's very, very similar to the response that we saw in that sympathetic nervous system. If you remember, that was the stimulation of our autonomic nerves. So the things that happened automatically in our body, but stimulated under a stressful condition. If you remember, we said, remember the S for stress is S for sympathetic. This is very, very similar. This is what happens in that stressful state. We release a hormone we commonly know as adrenaline, but it's actually called epinephrine. So that's what it does. We have these 2 types of, again, they're called catecholamines, but don't worry about that. There's 2 hormones that come from the adrenal medulla. They actually work the very same way. Epinephrine and what's also called norepinephrine are stimulated in this stressful state to help increase our heart rate and blood pressure, and it helps to mobilize our body for emergencies. It's what gets us going, helps us in that fight or flight response in a situation where we're scared or stressed, or even sometimes excited. It helps to get us going. And that's what that does. For those of you guys who have extreme allergies, or maybe you know somebody who has extreme allergies, it is epinephrine that is actually contained in an EpiPen. An EpiPen carried around by those, again, with extreme allergies. In the event that they're exposed to that allergen, it does have the ability to close up their breathing passages. And so what epinephrine does, you take that shot and you inject it typically into the thigh, and that immediately going into the bloodstream helps to open everything up. It helps to open up those bronchial passages, increasing heart rate, increasing the breathing, again, in this kind of fight or flight response, but at least it's opening up to where they're not cut off of their oxygen. Most of the time, if people have to administer an EpiPen, typically best to go to the hospital so that they can have their heart rate monitored, because it is an extra dose of this hormone. We need to be careful that it doesn't increase heart rate too much. But that's what epinephrine does. All right, taking a look now at the adrenal cortex. So again, we see steroids coming from the adrenal cortex. And so you can see that all of the types of hormones that come from these end in the word coids, because that's their steroids. That's what that means. But main thing I want you guys to be familiar with is the names of these. So, but oftentimes people remember the different types of hormones that come from the adrenal cortex because they remember sugar, salt, and sex. Sugar, because it's specifically glucocorticoids that come from this gland as well, specifically one called cortisol. But gluco is the prefix given to, meaning glucose, or like our blood sugar. Salt, because salt is a type of mineral, and that's what's regulated by this hormone here. So it's specifically a type of mineral corticoid. And then we have sex, because we have in a very small amount from the adrenal cortex, sex hormones, androgens, also known as testosterone in the male, coming from the adrenal gland. Most of testosterone is going to come from testes, but a small amount can come from the adrenal gland here too. So again, the main thing to remember, sugar, again, is if you remember sugar, salt, and sex, remember the types of hormones, or the names of the hormones. So cortisol, regulating a little bit with our sugar. We're going to talk about these, but also cortisol is used as an anti-inflammatory in our body. So it helps with decreasing inflammation and pain. So a really good way to remember cortisol and its ability to do that process is remember that we sometimes purchase cortisone or hydrocortisone over the counter when we have some type of rash. When we put hydrocortisone cream on our body, that's exactly what it does. It decreases the pain, it decreases that inflammation that we have on that rash, and that's because of the containing of cortisol. So that's what we're looking at there. Aldosterone is the name of the other hormone that we're seeing from the adrenal cortex. Aldosterone helps to regulate our sodium levels in our body. So again, just like calcium, we need only a certain level of sodium, and aldosterone is going to help to regulate that and help to make sure that we have that proper amount. And then, like I said, sex, remember some sex hormones come from the adrenal gland. Testosterone in very small amounts can come from the adrenal cortex. So talking a little bit more about each of these. So again, glucocorticoid is just the type of hormone that cortisol is. So it affects our body's carbohydrates. So not just, again, cortisol helps with decreasing inflammation and pain, but also it has the ability to convert amino acids into glucose and help maintain our blood glucose levels between meals. So it's helping with regulating our blood sugar. As it mentions too, it affects protein and fat metabolism, burning both substances as fuel to help increase our production, our energy production. So as long as you know, the big thing to know here is that, again, if you're remembering sugar, salt, and sex, that's going to help you to remember the glucocorticoid and its ability to regulate blood sugar. But also remember that cortisol is the specific name of that hormone. All right. Then our mineralocorticoids, again, specifically aldosterone is the name of that hormone. So the chief mineralocorticoid is aldosterone. Aldosterone plays a very important role in the regulation of our blood volume, pressure, and the concentration of our electrolytes, and that is because of its regulation of sodium. The primary target of aldosterone is the kidney. What it does is it helps to stimulate the kidney into reabsorbing salt and water and the excretion of potassium. So it kind of tells the kidney that we need to hang on to more salt, and at the same time that releases the potassium and balancing our electrolytes. And as I mentioned, in a very small amount, we see sex hormones coming from the adrenal cortex. Sex hormones from the female are called estrogens. Male hormones are called androgens. We know them more specifically as testosterone, but androgen is just a type of hormone, but just, again, in small amounts. So if you're remembering the sugar, salt, and sex, then you can remember the glucocorticoids, mineralocorticoids, but remember the names as well of these different hormones. And then, so gluco, mineral, and then the sex hormones. But if you're just trying to remember the hormones and the names of the hormones, and that is totally fine with me, remember cortisol, aldosterone, and then in small doses, estrogen and testosterone. I'll show you a chart that I have that I've posted on your all's review section that helps maybe to remember that. Okay. All right, so then we have our pancreas. We labeled this as number 4. Our pancreas is a very important organ. It is located just across the upper abdomen. They have the type of tissue and cells inside the body are called the islets of Langerhans. And specifically, they are the ones that secrete these hormones. There are 2 different types of cells, specifically of these islets of Langerhans, alpha and beta. Alpha cells secrete the hormone called glucagon, and beta cells secrete the hormone called insulin. What's great about these 2 hormones is they work opposite of one another. This is the pancreas, the job of the pancreas in our endocrine system. We'll talk later about how the pancreas is involved in our digestive system as well. But the job of the pancreas in the endocrine system is to balance out our blood sugar. So just like calcium had 2 different hormones to regulate it, remember calcitonin helped to decrease our blood calcium, and PTH helped to increase our blood calcium when it was needed to balance it out. Glucose, again, needs to be here. Insulin is actually going to be what helps to lower that sugar when we need it, and then glucagon is going to help to raise it when we need it. So I think we're going to talk about it a little bit more. Yeah. So blood glucose, what happens, the levels will rise. In the event that our blood glucose rises, and that is very normal, our glucose will rise when I eat an apple, or even more so when I eat a piece of cake. In the event that that blood glucose level will rise, then pancreas will secrete insulin, and insulin is designed to bring it back to a normal level. And again, it is a negative feedback, so it will turn off once our blood glucose gets to that normal level. When blood glucose levels fall, and this could happen for a number of different reasons. Maybe we are fasting and therefore our blood sugar is kind of slowly falling. Or perhaps maybe we are exercising. Sometimes when we are exercising, we take some of that excess glucose that we have in storage in our body and we use it for energy. We burn that energy, so we need some more. So what happens is our body is going to go get that out of the liver where we have it stored, and we'll make sure that our blood glucose levels are normal. So then when that happens, it's glucagon that causes that to happen. So again, here's blood glucose, or where it needs to be. When our blood glucose level, when our blood glucose level goes up because of maybe some sugary thing that we've eaten, then insulin's going to bring it back down. When our glucose level falls, glucagon is going to bring it back up. We need to be here, and that's going to help that. So insulin and glucagon working opposite of one another. So insulin and normal metabolism. So what it does, so not that you have to really be too familiar with this, but increased transport of glucose into cells is going to be what insulin helps that, to do. It's using glucose as fuel, the storage of excess glucose as glycogen. Our body stores glucose in the liver and then converts it to what's called glycogen. That's how we store our blood glucose. Glucose in the blood is just called glucose. When we store it in the liver, we call it glycogen, essentially is what that means. So what it does to protein, it helps to stimulate protein synthesis, and fat, it helps to stimulate, fatty acid synthesis. So it's really important in that normal metabolism is what it does, has a big role in that. So what happens when we are deficient in insulin? If we don't have enough insulin, remember, insulin is designed to bring our blood sugars, level back to normal. If we don't have enough of it, we can't bring our blood sugar to normal. So this is where diabetes mellitus comes in. So if you or anybody you know has diabetes, it means that their body or their pancreas is not producing the levels of insulin that they need. And oftentimes they have to either take insulin or they have to inject insulin. It does have devastating effects if left untreated, because glucose has a huge role in our entire body, and if not regulated properly, can really throw us off balance. So this is really, really, really important, and why it's, again, that's so important to be regulated. And like I said, glucagon, its job is to help to bring our blood sugar up a little bit if we need that. The pancreatic hormone secreted by these alpha cells of the islets of Langerhans, its primary action is to simply just increase our blood glucose levels. Then we have some other glands. So that was, again, number 4 on our diagram. Number 5 we've already talked about. We talked about with the pituitary gland in the first video. Number 6 and 7 that we labeled are the first 2 that you guys have on your diagram here, on your PowerPoint. They're the gonads, gonads meaning sex glands. So the testes in the male secrete the hormone testosterone. Testosterone is the male hormone. It is, if you think about it, it is what makes male male. It is what is going to be, when that is produced or secreted, it is going to increase muscle mass, it increases bone density, it helps to strengthen the males, but also helps to deepen their voice. At puberty, we notice that their voice is changing. We know that they're getting chest hair and facial hair, and that's because of testosterone, and that's what's happening there. Estrogen is very similar on the opposite end for females. Estrogen is what makes females female. So in the developing of, all of their secondary sex characteristics, like we just talked about with males, estrogen is responsible for the start of the menstrual cycle. It is responsible for mammary, the breast development, facial hair and pubic hair, things like that. So that's, again, those 2 hormones are kind of opposite of one another in the different genders. Whereas progesterone is another hormone secreted by the ovaries, the female gonads. Progesterone has a big role to play in a number of different places, but its most important role is during pregnancy. During pregnancy, progesterone is secreted more so because its job is to help maintain that uterus. As a baby grows and develops within the uterus, progesterone is going to be what helps to increase the uterine size and build up the walls of the uterus around it to help to protect that fetus inside of it. So that's what progesterone does there. So I'd be familiar with, again, testosterone is the male hormone, estrogen, female hormone, but also be familiar with progesterone, also in the female end, and its role in pregnancy. The thymus we labeled as number 9 on our gland labeling sheet. The thymus is, if you remember when I was walking you guys through the labeling, that I mentioned that the thymus you may not find on all labeling sheets of the endocrine systems if you find other labeling sheets. And that is because oftentimes the thymus is really, really, really important in adolescence, or really in childhood development, and it kind of starts to decrease in size after adolescence. That's because what happens is it is very much responsible for helping to our immune system to develop. So it produces a hormone called thymosin. So hopefully the name is easy to remember. The thymus gland secretes thymosin. But that's what that does. It helps our body understand, how to respond, how to act when we're exposed to different viruses and bacteria and things of that nature. So it helps to teach our immune system how to be the immune system. After it's taught our immune system what to do, it kind of just goes away. What happens is it starts to atrophy. If you remember, atrophy means weakening. I think we talked about the term atrophy when we talked about our muscle tissue, and that's what happens with our thymus, is it starts to get smaller and smaller with age and almost disappear. So that's what the thymus gland does. So again, very much involved in childhood. We'll talk more about the immune system when we talk about our lymphatic system, so we'll get a little bit more into what I mean by that. But as long as you guys know thymosin and helps with developing our immune system, then you've got thymosin down. And then the pineal gland, we labeled the pineal gland as number 8 up in the skull. It was located between the cerebral hemispheres of the brain. The pineal gland only secretes one hormone called melatonin. Melatonin helps with our biological clock. What I mean by that is melatonin is a hormone that is secreted at the time that my body knows it's time to go to sleep. It's what makes us sleepy. So it's a really great hormone. At that time, and it's a biological clock because our body recognizes, typically, everybody has kind of a different schedule, I know, but typically when the sun comes up, that's our time to wake up. When the sun starts going down, that's the body kind of recognizing that we need to start winding down. And so the body starts secreting melatonin. Again, this can change with the adjustment of schedules, but that's what I mean by that biological clock. Melatonin can also be purchased over the counter. You can actually purchase, for some people who are having sleep issues, sometimes they purchase melatonin because it is a more natural substance as opposed to taking things like Ambien or any type of sleeping medication. Melatonin is more natural and you find it in your vitamin aisle. So just FYI for those of you guys who may be having trouble sleeping. And then there are so we've talked about all of the endocrine glands that we've labeled on our diagram, but there are some other organ-specific hormones that we'll actually get into in certain chapters. They are secreted by organs such as the heart, kidney, and digestive organs. We'll talk about one in the kidney called erythropoietin, or EPO, and it's going to help unless we've already talked about it. I can't remember if we've already talked about it in the blood chapter, but EPO, erythropoietin, I think we have. EPO is designed it's secreted by the kidney because blood is constantly being filtered through the kidney, and that's how we're going to create urine. I'll get into that later. But it recognizes when our blood levels are low, and so it targets the red red bone marrow to create more red blood cells. We have other hormones created by our digestive organs. We have hormones created by the heart. So there are specifically just hormones created by themselves so that we can, help with whatever might be happening. And in the heart, for instance, we have what's called, not that you guys have to know this, but it's called the atrial natriuretic factor. And its job is to help regulate blood pressure, for instance. And it's stimulated by the right atrium. So it's, it's its own hormone to help regulate pressure in our blood. So there are some that are just very specific to certain organs. We have another type called prostaglandins. These are actually secreted by most of our tissues. Different prostaglandins, they're, like I said, they most will act very locally. They play a role in the regulation of smooth muscle contraction, which therefore helps to change the inflammatory response, or helps to actually stimulate the inflammatory response and pain, which is a good thing. Again, if you remember, we talked about pain, that we need pain to tell our body to respond accordingly. So these prostaglandins are secreted by these tissues in the event that they need to create that inflammatory response. So we see swelling and pain, and sometimes that can be a little too much. So that's where, if you guys are familiar with over-the-counter medications, ibuprofen, or even aspirin, it's these medications, how they work is they actually can stop our prostaglandins. They block the synthesis of these particular hormones, and therefore will stop that process of inflammation and pain. So just kind of a little FYI on that. So it's just another type of hormone secreted by a lot of our tissues. Okay, and that is the end of there we go. That is the end of chapter 14. I wanted to show you guys real quickly. Let me see. I think I still have it up. Yes. This is what I put on your all's. Right now it has all these little hidden symbols because I'm making this video early. But in week 6, underneath your PowerPoints and review sheets, there is a endocrine system table. I just found this online. It does label all of our different endocrine glands that we labeled in the previous video, but it does give a great chart, which I think is a great study resource. Again, I told you guys in the first video that as long as you guys know the gland, the hormone that comes from the hormones that come from that gland, and then what those hormones do, you're going to be great on this test. So this is a great study sheet. It does go over the type, but you guys don't need to worry about the type. But again, just looking at what we've talked about already. So here's your posterior pituitary gland that we talked about in in the video 1 from this week. So there's oxytocin and the antidiuretic. Anterior, so here's the different hormones that come from the anterior side. Make sure. Yeah, and then there's their results. So there's what they do. So there's your thyroid that we talked about today, T3, T4, and calcitonin, and here's what they do. The parathyroid, again, parathyroid hormone. The pancreas, insulin and glucagon that work opposite of one another. There's your adrenal medulla. Like I said, we talked about epinephrine and norepinephrine. With the adrenal cortex, again, we specifically talked about glucocorticoids and mineralocorticoids, but we specifically discussed cortisol and aldosterone. So remember those two. Those are important. That may not be listed on this chart. So if you print this off, you might want to write that in. Let's see. Then we talked about the gonads. Remember sex glands. So testes in the male secreting androgens, specifically, again, testosterone, whereas the female ovaries produces estrogen and then progesterone. So it does mention progesterone regulation of the menstrual cycle, but as well as, again, we talked about its role in pregnancy too. Progesterone, as I mentioned, kind of does a number of different things on the body, and that is just one of many. The pineal secreting melatonin, the thymus secreting thymosin. So there are all of our different hormones on a table for you guys if that's something that you want to reference. It might be something that's helpful. And I do recommend, even if you use this as kind of a guide, the way that I first studied the hormones that I thought was pretty helpful, I tried to create a table like this just from memory. It's really a great way to study if you can just, on a piece of notebook paper, if you just write, just think of one of those. There's only 9 glands that we've labeled, but if you just write on a piece of paper, thymus, then think, okay, what does the thymus gland secrete? Okay, thymosin. What does it do? And then on the next column, write that it helps with our immune system. And then think of another one. It doesn't have to be in any certain order. Pancreas. insulin and glucagon. You know, so if that helps, it's a great study tool, I think, to try and do something like that. If you guys, as usual, you guys know if you all have any questions at all, please, please, please reach out to me. I know sometimes the hormones can be tricky, and that's why I cover chapter 14 on its own, but I'm here to help if you guys need anything at all. Thanks, guys.